Hello. Do you know the difference between telemedicine and telehealth? I thought they were the same. But today, in this episode, we will discuss the difference between both terms, telemedicine and telehealth, and we will also see their advantages and the challenges in healthcare. So let's get started. Telemedicine and telehealth are two evolving fields. They are technology-based fields that provide clinical and non-clinical services to patients remotely. So clinical services like diagnosis, first consultation, diagnosis, and treatment, and this is called telemedicine. But if the approach is broader, and then the healthcare system or provider will include education, follow-up, monitoring for chronic diseases, for example, and also administrative meetings, then this broader scope is called telehealth because it provides also non-clinical services to the patient. The main benefit of both telemedicine and telehealth, and we will discuss this in details later, but mainly is to improve the access of patients to healthcare, to quality healthcare. And in this context, if we think telemedicine or telehealth, of course, no one is better, no one is worse, but telehealth provides a different approach that is considered an add-on to the normal clinical practice, because routinely in clinical practice we don't offer services like education for the patient, follow-up and monitoring remotely, or even administrative meetings. The patient in normal situation has to call the healthcare premises in order to fix an appointment. But including these services in the healthcare means that we are adding on more non-clinical services using this telehealth approach in order to achieve better outcomes for the patients. And here, it is not only that we are solving the problem of access, but also we are adding additional services, the non-clinical services, in addition to the clinical services that are routinely provided. The main benefit of telemedicine and telehealth is the increased access to care. And this is specifically very important when we discuss countries where the healthcare premises and the consultants and specialists are centralized in the big cities or in the capital. And so patients in rural areas or in remote areas, they find it sometimes difficult for them to travel maybe 12 hours in some cases in order to reach a specialist or a consultant in certain disease or certain field. So telemedicine is a very good solution for those patients. So it will provide convenience and it will enable them to have access to healthcare. And also this is important when we consider acute conditions, the cases that needs immediate clinical attention. Here also telemedicine and telehealth can provide a very good service to the patients. Even if you are in a capital or in the city, sometimes it's very convenient to have the follow-up call with your doctor via telemedicine. You don't need to go to the hospital, whether it is near or far. When we consider the telehealth component providing extra services rather than the clinical services, that means education, follow-up, monitoring, this adds to the benefit in terms of the patient will feel special, the patient will be more keen to follow the instructions, the patient will be more compliant or adherent to the medications. So this extra non-clinical services can definitely bring a new parameter to the healthcare, which is the personalized care and the continuous care, even after the patient leaves the clinic or between the appointments. Definitely, telemedicine is a cost-effective strategy for the healthcare systems as well as for the patients. So the healthcare systems, from one side, they will save money, reduce crowd, and definitely will have less cost. And also the patient will not travel and will have less cost per appointment or per interaction with his healthcare premises. The other important point is that telemedicine and telehealth, if adopted systematically and regularly at larger scales, they can really contribute to improved public health. Because, for example, if we look at the infectious disease control should be taken very serious during the outbreak of an infection or a pandemic. And of course, we have learned a big lesson during the COVID pandemic, where telemedicine and telehealth were used significantly in order to reduce more infections and more transmission of the virus. And it should be the case. The more you expose yourself to others, the more the infection will spread. But if you are at home, that's safer for everyone, even for the treating physician. So having this telemedicine and telehealth position in order to improve public health can include more examples like this. When we talk about the challenges, of course, let's keep the first big challenge aside for now, because it's the relation between the physician and the patient is a critical success factor for the interaction, for the treatment. It's part of the treatment to have a face-to-face interaction with the clinician or the treating physician. But other than this, there are challenges, of course, related to modern technology, because modern technology, as we talk now, is not universal. So in some areas it works, in other areas it doesn't, or it doesn't work with the same efficiency and speed. So this should be taken in consideration. We have also to consider that we are working with machines. So computers, technology, video conferencing, which is the most common platform for telemedicine and telehealth, they are machines and systems. So malfunction is something common, errors are common. And of course, this would be associated with a missed appointment, and it would be more significant if the patient is in an acute condition, for example. So modern technology and the adoption of technology across the globe is not the same, and this presents a challenge. Another challenge also related to technology is the level of adoption of the individuals using this technology. So maybe not all patients are technology savvy or technology friendly. So the system that will be used, is it easy? Is it difficult? Which system we will select in order to communicate to our patients? All these factors, they sound small, but they are important to consider in order to have a successful interaction with the patient. So imagine that you set everything up, you ask the patient not to come just for a routine visit, and that you will call him during his appointment, and somehow it didn't work. So maybe the patient will not have his medication on time. Maybe the patient will miss to tell something important. So these things should be very well planned in order to have a successful telecommunication. There are a lot of regulatory and legal considerations, but generally, one area that was not yet explored, I think, when it comes to telemedicine, is the second consultation. It may be happening now, but I think it can be expanded and it can be leveraged in order to ensure that patients, regardless where they are having high quality care. And the second opinion or the second consultation, I think, is part of it. There are a lot of diseases that are very difficult to diagnose. Second opinion is definitely important and should be considered. Having now the technology available, it is something that we should do. Other challenges include, of course, privacy. So, privacy and the data security are always a concern when it comes to adopting a new system or a new technology. There are technologies that are providing some solutions for this. However, it will remain, I think, a concern. In telemedicine and telehealth, the patient can exchange documents and information online. So, maintaining security and of these systems and maintaining data privacy and patient privacy considered also a challenge sometimes when we are talking about telemedicine. The personal preference. And some patients, they just don't like being online, so they can refuse. So we should not also, as healthcare professionals and as working in the healthcare industry generally, force the patient to have a consultation online. It may happen, but the patient may not be satisfied. And I don't think that from even a marketing perspective that this is something good. And we have to explore this proactively. So I think, and I have been exposed to different telemedicine interactions. I was always consulted if I want to do it online or I prefer to come to the clinic. So this is the way it should happen. The in-person examination and assessment of the patient is the right way to be certain of any diagnosis. So this is a relatively easier session compared to the previous two sessions. So I hope I covered what is needed for now about telemedicine and telehealth. I think the most important and maybe the new for some is the concept, the difference between telemedicine and telehealth. We are providing clinical services, including consultation, diagnosis, and treatment. Then we are talking about telemedicine. But if we are talking about the broader approach, where we will provide services like medical education, follow-up for the patient, monitoring, or even administrative meetings to fix an appointment and discuss administrative topics, then this will be the telehealth. The telemedicine and the telehealth are a very good solution for the access for patients. So if we use it in this context, if we use it in the context of reducing travel, reducing cost for certain stable cases, I think that would be a very good strategy. And definitely this will reduce the burden on the healthcare system. Thank you very much and see you in the next episode.